name is Mark Kindy. I'm a professor in pharmacy at the University of South Florida, which is in Tampa. And I'm also a senior research scientist at the Haley VA. So we do a lot of work in a whole variety of diseases. These are all by disclosures. I wanted to have a special thanks to the organizers for the invitation, and then also for the families and the parents of the kids that come. It's a great exposure kind of for all the young investigators to really focus on the diseases. We're not just doing science for the sake of science. We're actually doing this to cure diseases and everything. Won't go into this because everybody knows about mitochondrial dysfunction, but I did want to kind of point out one thing here is that we do a lot of work in neurodegenerative diseases. So with neurodegenerative diseases, you have a disease kind of going on which affects mitochondria, and then continues to kind of have problems associated with that. Now there are some people who believe that mitochondria kind of cause the disease, but they're not really mutations associated with that are going on. But then there are also true mitochondrial diseases that we've talked about. One of which is kind of shown here, which is Friedreich's ataxia, which is a, which you have a decrease in frataxin, which we're not really sure exactly what it does. It seems to be linked to some of the iron-sulfur clusters that kind of occur in the mitochondria, and with the decrease in frataxin, then the mitochondria get defective and have problems associated with those. So we can look at both neurodegenerative diseases, which are not truly mitochondrial diseases, but then also look at true mitochondrial diseases, see what's going on. So as we know, kind of with the mitochondrial transplantation, there's a number of different things that have been discussed about problems and things that we have to deal with. About mitochondrial delivery, how are we going to do it? What kind of mitochondria do we use? Do we use, we're trying to use both things here. Do we use naked mitochondria? Do we use peptide conjugated one? Do we use EV encapsulated ones? How do we do it more? The tunnel nanotubes have been shown that are in the cell fusion. At any rate, we're getting the mitochondria into the cell to help with the function and getting increasing ATP. Well, we've taken an approach. Again, I'm not a mitochondrial biologist. I'm a biochemist by training and a neuroscientist by hook or by crook. But we've been looking at recently, we're working with a company called Mitosense that has an interest in mitochondrial transplantation. So we kind of started looking at isolating the mitochondria in a variety of different techniques, a way to do that. Look and make sure that they, as kind of discussed, that the morphologically, okay, the function, the number of kind of those associated with it. And then looking at, in our case, we started with like Alzheimer's mice, look at the mitochondrial transplantation and see what's really kind of going on. So if you look at, again, we use a number of different cell types, isolating the different types of mitochondria. And interesting point is cells have different amounts of mitochondria. So you have to take that into consideration and look at the quality and quantity and the viability. And you can see, under microscopy, you can see, the mitochondria there. And then if you stain them with some mitochondrial dyes, you can see they're functional. And again, running some, a seahorse assay, which looks at oxygen consumption rate in the mitochondria, you can see that they're functional. And then if you look at, are they purely mitochondria? And again, there's a lot of debate with that, how to look at it. But if you look at cytochrome C, which is a mitochondrial protein, you can see that they're pretty clean, the ones that we're kind of working with. So we've been able to establish a technique to kind of isolate those. Okay, now. We've cured every mouse and rat of every disease known to man. Okay, we haven't translated that very well yet with that, but we're trying to get there. All right. Speaking of mice, so there are a whole bunch of different kind of Alzheimer's mice out there. So you can use over a variety of different ones. But we took those, and if you isolate the mitochondria from the brain of these animals, and again using a variety of different techniques. And again, you can't see it because there's so much kind of going on here, but essentially the mitochondrial function is suppressed in the animals. And as they age, it gets suppressed even more and more. Well, if we do transplant in our mitochondria, and then again, discussion, how do you go about this? Okay, when I do experiments, we like to go mouse to mouse and human to human, not kind of doing all these funky human to mouse, mouse to human type of thing because there are problems with those. But if you do that, you can increase the function of the mitochondria based on the oxidative consumption rate. And then if we take our mice, and again, you can't see very much of this, but you see these little brown spots that are in it, those are the amyloid plaques that are part of the disease process, okay? If we give them low-dose mitochondria, high-dose mitochondria, you can actually show a dose-dependent reduction of the amount of plaques that are in those animals. And again, that's kind of quantified here. And again, if you look at inflammation, it's reduced. You look at behavior, they show better behavior when giving back the mitochondria. And what Jonathan kind of showed earlier and didn't present it, but they seem to be taken up by proteoglycans, heparan sulfate proteoglycan, maybe others. We have a collaborator who's looking at all the different proteoglycans to see what impact that may have. But if you knock it out in cells or in animals, it actually reduces the uptake of the mitochondria into those. And then we also looked at, again, as Lance kind of showed, where are the mitochondria going? We're giving them systemically. So unfortunately, some of us don't have tails. The mice have tails, and so we can inject them by tail vein. Initially, it's hard to do, but if you try it hard enough, eventually you can't miss the tail vein. You kind of only 2 minutes left. Wait a minute. Anyway, so if you look, we can show that it actually gets in the brain, gets into all the different cells in the brain because of the damage. And we have follow-up studies that have kind of shown that the mitochondria go into the damaged cells more effectively than into the healthy cells. We also showed in models of TBI that we can improve the outcomes when we're giving it. In these animals, we did ICV, intracerebral ventricular injection, IV and IA, intraarterial, and we showed kind of the same thing. So how about true mitochondrial diseases? So again, we looked at Friedreich's ataxia, and we could show, again, they show a decrease in OCR, and again, if you give them back the mitochondria, you can improve function. AIF had 1 mutation, which is another protein in the mitochondria, and we can show, again, we get functional increase there. We're looking at a number of other animal models, but then how are we going to translate this as has been come out? So again, we've been looking at different types of cells, isolating the mitochondria, frozen and fresh cells, seeing that kind of in the same way to isolate the mitochondria. If we give extracellular take the mitochondria and put it with extracellular vesicles, it protects them, as well as with nanoparticles. And I think there was a poster that kind of showed some of this as well. And we're now looking at, can that facilitate the uptake of the mitochondria into the cell? All right, where do we kind of go from here? So again, working with MitoSense, we now have GMP and GLP quality ability using clean rooms or working with one of these biospherics units, which again creates kind of a clean room to isolate the mitochondria from the cells. Working with another company, we have FDA-approved cells. We're using mitochondria, mesenchymal stem cells that come from umbilical cord. So we have tons of them that, millions and millions of cells we can do, and from that we can isolate millions and billions of mitochondria fresh and do that. We're also looking at ways of freezing them and storing them so they can be off the shelf to kind of be able to use under those different models. We're also looking at various ways of delivering it. As we said, ICV, which is not really good for patients, but in some cases maybe. IV, IA, nasal administration as well to try to get them in there. And then for maybe spinal cord types of things, using intrathecal. And then again, different ways of doing it with applying them with nanoparticles or different types of peptides and things that can allow them to get in there. So with that, I'd like to kind of finish up here because I have no time left. We're working with MitoSense and isolating the mitochondria. With it, they actually have a patent kind of on some of the technology. Walter Reed for some of the TBI, Greenwood Genetics Center for some of the Alzheimer's and X-linked diseases, Karolinska Institute for the extracellular vesicles, Baylor for some of the space flight and NASA things, and then my collaborators at the VA. And so again, just summing up, again, we need, as kind of discussed, what are the best animal models, how can we translate that into the humans, drug delivery, therapeutic approaches. We're also looking at aging and senescence as ways to kind of look at it. And then trying to look at developing some clinical trials. The company wants to go into ALS. We have tons of ALS patients at the VA hospital, but we also have at the university Friedreich's ataxia patients that we can possibly go into and see what effect we may have on a true mitochondrial disease. So I'll stop there. Thank you very much.